All right, here we are. Here we are. Thank you all so much for being a part of this wonderful live. Thank you for taking time out of your busy schedules. I'm really, really excited about the conversation that we're going to have tonight. Before we get into it, I'm going to ask you, if you're watching, please share. We want you to share this broadcast. We want you to share this stream. We want to make sure that everybody is able to hear this, everybody's able to get this information, because I think this information is some of the most critical information that you will hear, especially in the Black community. So we want to make sure that we get that together. So I'm going to jump right into it because we've only got about 30 to 45 minutes of this conversation, and I know that our guest has a lot of impactful information for us on today. So I am pleased, very, very pleased to have with me on the live tonight, Miss Damara Irvin. Miss Damara Irvin, and she is a part of this fantastic week, this fantastic organization. Hopefully you've been seeing the hashtag Black Maternal Health Week, Black Maternal Health Week. And the reason why I wanted to have this conversation, because like many of you, hopefully many of you, as you've been reading and maybe seeing snippets here and there of this very, very important topic. I was maybe a few months ago, Damara, I was reading a CNN article, and the information absolutely blew me away. And then just a few months later, I was on, actually this was maybe 2 or 3 weeks ago, I was on with Dr. Chenault at the University of Louisville talking about vaccinations. And he talked about what we're going to talk about tonight. And again, it just blew my mind. And that's when I said, we got to have this conversation. And then, of course, after my sister-in-law, your colleague, told me about this week. And I said, this would be a wonderful, wonderful time to have you on. So first and foremost, and I do have questions. They are written down, because if not, I'll just ramble and go on and on. And that's ridiculous. You don't have time for that. So first and foremost, please introduce yourself, your title, your role at the University of Louisville, and tell us a little bit about Black Maternal Health Week and what the Louisville Coalition for Black Maternal Health is.
Okay, so I am Damara Jenkins. Van Irvin is my maiden name. And I am a certified nurse midwife. I am the director of midwifery and women's health at the University of Louisville. I have been there for about 6.5 years. Prior to that, I worked across the river and in Bardstown, Kentucky, and then originally as a labor and delivery nurse at UofL Hospital. Other things that I do for the community, other than my main job, would be I sit on the committee for Kentucky for maternal mortality review. So we review all of the maternal deaths in the state of Kentucky, and we look for recommendations and things we can do to correct those deaths. So that's very important work, and work I'm honored to do. Other than that, we have formed a coalition in Louisville, as you've mentioned, the Louisville Coalition for Black Maternal Health, so that here in Louisville, we can do some local efforts to advocate, educate, and empower, so we can change our story here, right at home.
Absolutely, absolutely. So tell us a little bit more just about yourself and this journey that you're on as it relates to maternal care, and specifically maternal care for Black women.
Well, I mean, that's the majority of what I do as a certified nurse midwife, is care for women through pregnancy and birth and afterwards. But other than that, being a certified nurse midwife, like I didn't say this, but I was the first nurse midwife to participate deliver in hospitals here in Louisville. So although nurse midwifery and midwifery is old, it's pretty new around here, and not a lot of access. So I have been blessed to be able to improve and increase the access to midwifery. And midwifery care, we know, just gets better outcomes because we practice from a wellness model. So in that way, that's what I've done. I also happen to be one of only 2 Black nurse midwives in the state. And as far as like home birth midwives who may not be nurses but are professional midwives, we don't have any, like in our state. We do have a wonderful woman that's based in Southern Indiana that sometimes will help us out. But so for myself, I'm one of the few. And one of the things we do know is that being able to get care by folks who look like you, understand your background, and how you were raised, and the things that you're facing every day can make a big difference.
Absolutely.
Yeah.
Well, let me ask you this, and this is, I want to jump right into some of the statistics and some things that people may not have heard. And this is where, again, it absolutely blows my mind, because it's pretty well documented that and reported that Black women are 3 to 4 more times likely to die from pregnancy and childbirth related complications than white women.
Yes.
Black women are 3 to 4 times more likely to die from pregnancy and childbirth related complications than white women. Here's the $1 million question. Why is that? And what factors are contributing to this?
Yeah, so that is a really important question. And what I don't want to see from all of our talk about the higher rate of, maternal death for Black women are women being afraid. Because what I'm having is women come to me saying, I'm afraid. I'm Black and I'm pregnant and I'm really scared. And what I'm telling them is you're not higher risk because you're Black. We are at higher risk because of racism.
Wow.
That means we can do something about that.
Yeah.
If it was just because we're Black and it's in our genes, then what can you do, right?
Mm-hmm.
But that's not what it is. It's racism. And the really sad thing is not just the numbers, but research has been done for over 30 years to prove the cause is racism, not race. So if we had been paying attention in the healthcare field, if people have been paying attention, we've known this for a very long time and we've had the evidence and the proof. And even, I went to graduate school, starting 15 years ago, and we still were talking about the risk factor is race. We weren't saying the risk factor is racism. So we have to acknowledge what the cause is. Because if we just say, oh, it's because you're Black, I can't do anything about that. I am what I am. But that's not the cause. The cause is racism. And, there's several ways that we know this. But then on the other hand, what do you do about systemic racism? That's huge too. But at least you can do something. And it really all boils down to that.
Yeah, well, I'm gonna be honest, Damara. It's for me, and again, we talked about why we're having this conversation. The more I've delved into this and read the statistics, the more I was convicted as a Black man. I was convicted as a Black man. I was convicted as a pastor because I'm saying to myself, 3 to 4 times more likely to die. How is this not a national emergency? How is this not leading the headlines? If we know this is to be the case, if this would be any other race, this would be getting way more attention. And I think I struggle with hearing those kinds of numbers, knowing that it's racism, not race, as you wonderfully pointed out, and yet not hearing people talk about this at all. That's where I'm struggling through that very much. Do you work with churches, work with people? Like, how do we get this information, not just out there, because I think you all do a fantastic job getting the information out there, but how do we make this more of a 911 situation?
Well, and that's why we formed the coalition, and it was in response to a national group called Black Mamas Matter Alliance, which formed 4 or 5 years ago, and they have started a whole week every year. April 11th to the 17th is Black Maternal Health Week, and the whole goal of the week is to advocate, educate, empower, and center the the voices and the stories of Black mamas.
Yeah.
And so, that's the whole point of the week, is to get it out there. Wow. And last year, Shakira Elmore, who's a public health student at UofL School of Public Health, took it upon herself as a project for school to do events in Louisville around Black Maternal Health Week. COVID interrupted that, but this year we were able to take up her gauntlet and continue. And so we have pulled together all kinds of folks in our coalition, not just healthcare people, not just therapists, but social workers, the Department of Public Health, any kind, we call it perinatal service provider, anybody that serves Black mamas. Mm-hmm. And I firmly believe that that also includes places of worship.
Absolutely.
So, and it's interesting you asked me, because I just had a conversation with my nephew, who is a new up and coming pastor, and he's going to join the coalition to make sure that we get Black churches in the coalition and involved in helping us educate and get the word out.
Wow.
Because there are things that individuals can do. There are things that the healthcare system can do, healthcare providers can do. And then there are a lot of policy changes that can be made as well. So there's lots of things we can do to fix this situation. And we got to fix it.
We have to. We absolutely have to.
I don't want to keep hearing this. I don't want to sit on this maternal mortality review committee and keep hearing about Black woman after Black woman who's died from a preventable cause.
Right. And I think the first step with the general public is just education mm-hmm. and awareness. Speaking of that, and I want to read an excerpt, and I know you just said you want to hear anymore, but I want to read this excerpt for those who are on the live, and I want to get your reaction to it. And I saw this article again on the statistics related to Black newborns who are cared for by white doctors. Again, statistics on Black newborns who are cared for by white doctors. Here's the excerpt. Black newborn babies in the United States are more likely to survive childbirth if they are cared for by Black doctors, but 3 times more likely than white babies to die when looked after by white doctors, a study has found. The mortality rate of Black newborns in hospitals shrunk by between 39% and 58% when Black physicians took charge of the birth. By contrast, the mortality rate for white babies was largely unaffected by the doctor's race. This was reported by CNN. And again, I was on a panel with Professor Chenault of UofL School of Medicine, and he discussed that very thing. We've talked about racism, but can you dig deeper into that and tell me how in the world is that happening?
Well, yeah, I mean, that is hard, because then you would say, well, the answer is make sure that you take your Black baby to a Black doctor. But there's not enough Black doctors or Black nurse practitioners. There's not enough Black nurses. There's not enough Black people in leadership to make a change. And we do have to acknowledge that the white doctors are not doing these things on purpose. So, as I said, 15 years ago, when I went to nurse midwifery school, I was taught that race was a risk factor, not racism. So we need to change the education. In healthcare, we have to get really loud and make sure that we're pointing out the problems, make sure that everyone is educated in how they are adding to the situation, and start rebuilding the system. So, one of the things is, we know, for instance, that that Black women don't get paid as much attention to as far as pain. So they're not heard as well. A lot of the stories that we'll hear, and they're individual stories, but the stories that we'll hear of women that ended up having problems, they were telling folks, I'm having a problem, and nobody was listening. And at some point, women stop complaining because they think nobody's listening. I must be making a big deal out of nothing. And then we end up missing some very important signals. So women and, doctors and nurses, we have to start listening. And we have to, start understanding that, Black women feel pain just as much as anybody else.
And Damara, I remember Dr. Chenault to that point. He made mention of a very old but still prevailing sort of racist ideology that Black women have a much higher pain tolerance than white women, so they are under-prescribed necessary medication.
Yes.
Is that something that you've heard or seen?
I don't think that I've seen it, but I probably have, because as I said, I've worked in healthcare for over 20 years. But that's the thing, is that we have to call it out. We have to look for it, because it's happening, obviously. And I'm sure most healthcare professionals don't think that they're contributing to this, but some of us are somewhere. But so in order to fix that, we have to go back to the root, which is we are all raised in this culture and society, which raises up white, skinny, educated, rich as the epitome, right? And that's our archetype. And so we judge everything based on that. Growing up, as we all, how many times did I hear about how I had good hair and all I wanted was some more curls? But but that's what everybody said, that's our archetype. So we're judging everybody else based off of that. And we need to get rid of that. We need to understand that that's not the end all be all. For instance, it shows up in BMI, body mass index, which is talking about, shapes of bodies and obesity and those kind of things. And what we call a normal BMI may be normal for, a skinny European white guy or white woman, but not necessarily for someone with African descent or, some other kind of descent. But again, that white archetype is what we're judging everybody against. So we have to go back and change that. And we all have to acknowledge that those stereotypes, those archetypes have been put in our head. They're on the edge of our consciousness. Right. And we have to pull them to the forefront so that we can change them.
Wow. Would you say, and again, and you're definitely helping and educating us tonight, would you say that there may be carelessness when it comes to these mortality rates and the way that, again, the fact that Black newborns, children are dying at that rate when they're in the hands of a white doctor? Is it carelessness? I mean, what is that?
I don't think it's carelessness. I think it's helplessness. So, even recently, I had a discussion with a white male physician, excellent physician. And he didn't want to hear about it because he said, things aren't happening because of my practice, because I know I don't do these things. And I said, no, you can't do that. You need to take a look at your practice, look at your numbers, and ensure that those things are true. You need to ask Black women. You need to ask them, did I hear you? Did I give you good care? If you didn't, then you need to change it. But he did not. He was hurt and offended that I would suggest that he was contributing to the problem. And so when I do talk to people, I always say, I'm contributing to the problem as well. Even as a Black woman, I was raised in the same culture you were. I was given the same archetype you were. So I also have to make sure I'm making those changes too. So, and that's the one thing. I don't think it's carelessness. I think it's helplessness. I think it's hard. It's hard to acknowledge that you have racist ideas and that your practices may be racist. It's very difficult to acknowledge that. It's also hard to know what the heck to do. How do we change systemic racism? And what we have to understand is the system is made up of the individuals. So at some point, that's where it's got to start. And that's another reason why we do things like this Black Maternal Health Week, so we can give people tools. We can come together and figure this out together. We got to figure out why we are, how we are. And then together we got to dream about how it should look. And then we got to figure out how to make it happen. But no, I really don't think it's carelessness, because most of the healthcare workers I know, they care an awful lot. That is their work. A lot of them, that's their passion, is to care for women and babies and people. and to help people have the healthiest outcome. Most of them don't realize that what they're doing.
Wow. You had made mention earlier about some of the reasons, and one of the words that you put in there is one that, you know, grabbed my attention immediately, and that's policy. Are there any specific policies right now or things that are not happening that we need to be taking a look at? Because I'm thinking about the person that's on this live right now that's also saying, what can I do to help? And I think one of the things that we can always do is call our local legislators, call our council people, call our mayors, governor, whatever the case may be. But are there any specific policies or legislation that we have or we don't have that would aid in dismantling or at least affecting these numbers that are horrific?
Yes. So Representative Attica Scott is the first name that comes to mind. She has several pieces of legislation out there to try to help address this issue. One of them is making sure that there is money and that there is a committee and organizations going forward to gather the data. Because, like I said, we gotta look at the numbers, so people can't say, "Oh, I feel like I'm doing a good job," and we can show them the numbers. So, no, you're not. No, I'm not. Here's the numbers. So we have a start to go. So one of her pieces of legislation does that. Another one helps to pay for doulas. We haven't talked about doulas yet, but doulas are professional birth support folks. They're not healthcare providers. They're not medical, but they're professional support. And it can be prenatal, during birth, postnatal, any kind of pregnancy related incident. Doulas can help you through that. And there's a lot of really good research that tells us that doulas, and again, doulas who look like you, who understand your language, can help women get better outcomes. Mostly because they feel supported, they can help educate. And for instance, at a birth, a doula will sit with a woman the entire time that they're in labor and through birth. Whereas us healthcare providers have other people to take care of, can't necessarily be with you constantly. So it makes a big difference. It's evidence-based, but doulas aren't covered by insurance. So one big thing we can do is make sure, at least through government-funded, state-funded insurance programs, Medicaid, that doulas are covered. And they have to be covered with a living wage as well. They can't just be a nominal fee, because that's a lot of work. That's a lot of hard work. And there's training involved. There's also legislation out there to make it easier to open an alternative birth center. Here in Kentucky, we don't have any. Birth centers are facilities where you go, you have your baby, you make sure everything's good, and then you go home. You don't have to stay. They're just for low risk women. They don't have epidurals. We don't have ORs. It's just for low risk healthy women. But these women, that they don't need a hospital, and putting them into the hospital, it exposes them and their babies to a lot of unnecessary interventions. So we see really good outcomes at birth centers and birth center models of care, and we don't have any in Kentucky. It's just red tape. So there is legislation out there for that. There's also legislation to increase access to advanced practice nurses. As a certified nurse midwife, I'm licensed in Kentucky as an advanced practice nurse, but it is very hard for me to offer my full scope of practice because we have a few policy things. For instance, I have to have a paper signed by a physician saying that they will be available if I need them to write certain prescriptions. And my training doesn't require that. My education doesn't require that. It's kind of an old holdover, and we need to get rid of that, because we have a lot of advanced practice nurses, nurse midwives that could open their own practices and clinics, and could because increasing accessibility is really important. So those things make it hard for us to do. The state has a policy that says you don't have to pay advanced practice nurses, but 75% of what you pay physicians to do the exact same thing, and we get better outcomes. That's a problem, because that means it's really hard for me to afford to open my own practice and offer my care to folks.
Mm.
Um, and to be everywhere. So we don't have any legislation for that right now, but that's something we could do. And just making sure that there is money available so that the type of care that nurse midwives give, the type of care that doulas give is accessible and available to everyone. Another thing we need to think about is making home birth accessible and safe as well.
Mm. Wow.
A lot.
No,
I'm
but that's
to the surface.
no, that is absolutely phenomenal. And also, when you think about, I know that Representative Attica Scott, you said that she has several of these bills that have been drafted. I think it's important for us, especially those who support her, to continue pushing other lawmakers to even allow those bills to be introduced on the floor. Because that's another big issue in Kentucky, is that there are people like Attica Scott, but they're not even given an opportunity to introduce these life-saving bills to the House floor. And that's a whole nother discussion when you have a supermajority of Republicans of white men.
That's a whole nother discussion. I have spent a very little amount of time in the halls in Frankfort, a little bit in Washington, D.C., in my role as an officer in the American College of Nurse Midwives for the state of Kentucky. And trying to advocate and push for legislation. And one thing I have learned is that your representatives really do listen to their voters.
Mm-hmm.
So we really need, that's another thing we need to do is advocate and empower voters to reach out to their representatives and let them know what you want.
Right.
And we do have a event tomorrow with the Louisville Black Maternal Health Week, all around public policy. Attica Scott will be there. Reginald Meeks, I believe, will be there. There's several other folks that are going to be talking. That are going to let people know this is what's out there and this is what you can do on this front to help change the picture.
Awesome. Okay, I only have two more questions, and this is fantastic. So, as a medical provider, a Black woman, and a Black mother, what is your advice to Black pregnant people who are concerned about themselves or their baby and becoming a statistic? And what advice would you give them to advocate for themselves and to do everything in their power to have a birth where they are valued, respected, safe, and live to see tomorrow?
Yeah, I would say ask that exact question to your healthcare provider. And if you don't get an answer you like, if you don't feel heard, if there are practices there that aren't addressing your needs, then find a provider that will. It's really that simple.
Yeah.
And also, look out there for information. Don't just go to your healthcare provider and think you're going to be okay and do what they tell you to do. Go in with questions. Do some of your own research. And make sure that you pick a provider so that when you do go to give birth, or if a problem does occur, that you can trust that that provider is going to advocate for you so you don't have to do it for yourself. A woman in labor should not be having to worry about protecting herself or her baby.
Wow.
She should have chosen a provider that's going to do that for her, that allows her just to do the work of birth.
Wow.
And you can change providers. You don't have to go. Just because you started with one, if it's not working for you, you don't have to stick. You can change.
You can change providers. Okay, this is my last question. In what ways are the local and national medical establishment and hospitals, including UofL, working to address the disparities that we've been talking about during this conversation?
Yeah, I would say, all the media attention has really helped to focus a lot of the healthcare organizations, our professional organizations, for a few years now, have really been spending a lot of time paying attention to this. And the first thing has been, we need to acknowledge it. We need to call it out. There was just a program in February called Call Out, specifically for that, so that we can call each other out in the health within our facilities and within our practices. So across the board, nurses, midwives, physicians, we're all paying attention and focusing on this. What was your other part of the question?
Well, in what other ways are the local and national medical establishments, including UofL, what are they doing to address the disparities that we've been talking about?
Yeah. So again, we're looking closely at our data, at our statistics, at our own in our own practices, in our own facilities. I am sure, because through this coalition, I've been able to speak with the other big healthcare systems in the city, that everyone is looking at those things very closely. Each area has, is developing programs to make sure that, we're addressing these things. Every big healthcare system that offers maternity care in Louisville is involved in this coalition.
Wonderful.
Yeah, I mean, there's plenty of work still to be done.
Yeah.
Don't get me wrong, but it really is starting. I do want people to feel encouraged that it is starting. And I would say, if you as a Black woman leave a practice or a facility because you don't feel like you're being heard or cared, let people know. Let them know why I'm leaving. Yeah. Because unfortunately, money talks. And if you take your money away, you take your business away, if it happens enough times that you let people know what you're doing, people will pay attention.
Wow. Well, listen, thank you so much for doing this. It has been extremely informative. I hope people that are watching have been inspired to do more than just listen. As you've heard, there's so much more that we can be doing, and we want to support people like Damara and this amazing coalition. Can you tell people how to connect with you all, where we can find you on social media and all that good stuff? We want to make sure we're supporting your work.
Yeah, so right now we just have a Facebook page. It's Louisville Coalition for Black Maternal Health. And if you go to that page, you'll see there are events for every day through this week. If you just click on the event, you'll find the link to register and get information about all the offerings this week.
I believe, don't you have an event at 6:30?
Yes, we do.
You do.
The event at 6:30 is really important because it's about preconception. So getting healthy before you get pregnant.
Wow. Yeah.
And make sure you play. And that is really important, because if you start out good, you're going to end up good. So
absolutely. Yeah. Well, thank you so much for being on here. I know you've got to run and get to your next event. I'm going to definitely be following, and I want to stay connected with you all because I want to make sure, and let me do this. I'm encouraging every church, every Black church, every Black pastor, every period, no matter what color you are, but every church, every pastor, every believer that's a part of the church, we have got to champion. We've got to push both legislation. We've got to support people like Damara and others. There is no way, absolutely no way, that we can hashtag love our queens and all that good stuff and then ignore this public health crisis. And we want to make sure we're using our voice and our platform to do so. So again, thank you so much, Damara. I'm praying for you all, and I'm looking forward to connecting and making sure that, from our end, we're doing everything we can to support you.
Okay, thank you so much.
Bless you. God bless you. Thank you all. And we'll be back on. Thank you.